This is a demonstration of the Stratagem Population Health Navigator. This is a health IT platform developed by Stratagem Health, which utilizes Stratagem Health's patent-pending risk stratification algorithm for patients. Stratagem Health's mission is to improve population health outcomes with predictive analytics. This tool leverages Microsoft's Power BI platform. For purposes of this demonstration, we're going to be looking at two locations, a hospital and a clinic. We're going to be looking at two specific conditions, diabetes and congestive heart failure, and two different subset of patients, women and patients with mental health. Let's start out with the hospital desktop. We have created test data from about 50 test patients. The two conditions we are addressing with the hospital desktop are diabetes and congestive heart failure, or CHF, for purposes of this demonstration. So you can see the title for the Case Manager desktop and the user info. Patients are listed by their name, date of birth, sex, age, address, and other demographics. And the two conditions are listed as well. Patients with diabetes are tagged with a red under that column, and patients with congestive heart failure are again tagged with red under that column. Now, Stratagem Health has developed a specific algorithm that is based off of the patient's age, sex, social or living condition, comorbidities such as diabetes and congestive heart failure, if they're getting the appropriate treatment, referrals, imaging, labs, if they're taking their medications, and all that is compiled into the Stratagem Health risk score, and patients are stratified as medium or high. With the Affordable Care Act, health plans, hospital systems, and clinics are increasingly being reimbursed for the quality of care they provide. And to provide best quality of care, they need to identify and accurately track their high utilizers and patients that are at high risk for bad outcomes, increased morbidity, and increased mortality. So the case manager would be able to screen patients that have diabetes. Of those subset of patients, he or she will be able to see those patients that also have congestive heart failure. Further, these patients are stratified by Stratagem's risk score into patients that are at high risk and those patients that are at medium risk. And those patients can further be drilled down by conditions such as diabetes and congestive heart failure. The case manager also has a preview of his or her caseload. For example, if the goal for this case manager was to maintain about 35 patients on an average with a total of possibly 75 patients, you can see that she's already hit that 35 and is actually a little bit over her workload, meaning that she may need some help. So this desktop not only focuses on patients, it also focuses on the productivity and the workload of case managers. Let's move on to a clinic setting. In addition to the regular demographic information and the risk scores, patients' location can also be identified so that the clinics can follow their patients by mapping them out by location. So for example, if a clinic chooses to have a diabetes training class in a certain location or a zip code, they can hone in on those patients. If there's going to be a mobile clinic visit or a case manager who's visiting a certain location, he or she can drill down and look for patients in that location. Patients with two or more coexisting conditions, in this example, congestive heart failure and diabetes, can be tracked. Their immunization status can be tracked. So for adult patients with chronic conditions, it's important that they get their pneumonia vaccine as well as their flu vaccine during the flu season. And it's critical for these patients that are high risk to get these vaccines. So you can see that there are a total of 50 patients, of which 44 would meet the high risk stratification. And of these, 23 have received the pneumonia vaccine, meaning that the remaining 21 need to be addressed. And then the flu vaccine, about half of them have received it. And this kind of a desktop is critical for clinics with limited staffing because it helps them focus their resources on those patients that are falling through the cracks. And for example, if a clinic serves 10,000 patients, and if 500 of those patients are at high risk, a desktop such as this would help the clinic's manager or the case manager to focus their resources on those 500 patients so that they can get the appropriate care, make sure that they're getting the right medications, refilling their medications on time, getting the right kind of referrals, getting their labs done on time, and imaging studies done on time. Now let's drill down into diabetes. This is a desktop of patients that just have diabetes. So you can see of the 50 patients, 29 of them have diabetes. And of those, you can see that only 12 are getting the right treatment. And this could be the right kind of medications, or that their labs are within the range that the physician and the patient had agreed upon, or they had the right kind of referrals or studies done. The majority of the patients in this example are not on the right treatment. And when you drill that down through a diabetes report card, you can see that some of them have not had an eye exam done, or have not been screened for kidney disease, or have not had a foot exam done, or their hemoglobin A1C, which is an external lab, is not within the required range. And that could be because it has not been checked recently. It could be because they're not getting the medication they need, or they're not refilled their medications, or are not taking it. So it helps the hospital system or the clinic drill down to those patients with diabetes who are not getting the right care. And these patients are further risk stratified to see which of them are at high risk. 24 of them of the 29, based on Stratagem's algorithm, would be at high risk. Again, for purposes of this demonstration, the test patients are at a higher risk than what you would see in the normal population. Now let's drill down into a congestive heart failure desktop. Again, you can see that the patients are risk stratified. We can see which of the patients are getting the right kind of medications, which of those are not. And then you can see coexisting conditions. For example, patients that have both congestive heart failure and diabetes together are at higher risk for bad outcomes. There's a heart health report card which tells the providers if, for example, their subset of patients have their blood pressure under check, which in turn allows the provider to focus on their medications, their dietary interventions, and so on, and also focuses on whether they're getting the right kind of care they need. There's also a tab for patients who are on the right kind of medications or not, and the algorithm aligns with the best practices put out by the American Heart Association. And so the right medication would be something that is a part of well-established practice guidelines. And again, congestive heart failure patients are stratified based on their risk. Now let's focus on a women's health desktop. Clinics and health systems, including hospitals, increasingly need to screen patients, especially women, for cancer. And that means mammogram for breast cancer screening and pap smears for cervical cancer screening. And most systems face this huge challenge in various ways. And one way to get to that is through a desktop which runs analytics to give some actionable items for a case manager or a nurse to, for example, call a list of patients who've not had a breast cancer screening done in a time frame, let's say 1 to 2 years time. The case manager would be able to run a report, look at her patients that have not had a mammogram screen, and then be able to call them. The same is true of those patients that have not had a pap smear for cervical cancer screening. Additionally, women that have congestive heart failure and diabetes and are at high risk based on our algorithm can further be selected and resources targeted towards them, not just for cancer screening, but also for management of their chronic conditions such as congestive heart failure and diabetes. And the last desktop for purposes of this demonstration are patients which have mental health issues. Increasingly, it is noted that just controlling medical conditions is not enough for well-being. It's important to look at the whole person care, which includes their psychosocial situation, their mental health situation, any problems with alcohol and drug abuse, and this would be in addition to their chronic illnesses. So this desktop looks at patients that have mental health illnesses, which of those have alcohol or drug issues, and of those that also have congestive heart failure and diabetes. If you were a patient who had congestive heart failure, had depression, and on top of that had an issue with alcohol or drug dependence, that by in itself puts you at very high risk for hospitalization and bad outcomes, and also increases your mortality risk. And the Stratagem risk score factors in not only their medical problems, it also hones in on their social problems, it hones in on their mental health and alcohol and drug abuse problems, and also factors in their age when it assigns a risk score. And you can see that of the patients, for example, in this case with mental health problems, you can see that 16 of them also have an issue with alcohol or drug dependence, and 18 of them have congestive heart failure, which puts about 20, which puts in a significant percentage, 28 of them, at high risk based on the Stratagem risk score. And these patients would be the ones to focus their resources on, because if the healthcare system is not able to do that, these patients are going to show up in the ED for multiple visits or be admitted multiple times, and essentially will end up having bad outcomes. So the tool itself, the Stratagem Population Health Navigator, helps hospital systems, clinics, and health plans look at patients across their continuum of care, assign a risk score, and then helps them focus on those patients that are at high risk for bad outcomes, so that they can prevent some of those outcomes and improve the health of the population. For the dashboarding and reporting, it uses the nimble Microsoft Power BI toolset. Thank you.